Metro on WDET. I'm Robyn Vincent. Seeing a doctor in America comes with a lot of costs. There's the wait for an appointment, the hours on hold with insurance, the pit in your stomach feeling when the bill finally lands, and it's a lot more than you expected. Now, millions of Americans are bracing for another cost they didn't see coming. The federal subsidies that have lowered health insurance program premiums under the Affordable Care Act are set to expire next year. And if they do, premium costs could rise by hundreds of dollars a month in 2026. Healthcare subsidies have been a key point of contention during the government shutdown. Last night, 8 Democrats broke ranks in the Senate, paving the way for an end to the shutdown, but not an end to the debate on healthcare subsidies. Senate Majority Leader John Thune agreed to allow a vote in December on the expiring tax credits. And here in Michigan, that uncertainty comes on top of another shakeup. 2 insurers are leaving the state's individual marketplace, and thousands of people are suddenly searching for new coverage. Meanwhile, some doctors are trying something different. They're stepping outside the insurance system altogether. It's called direct primary care, a kind of subscription for your doctor. You pay a flat monthly fee. You get care when you need it. No billing codes, no middlemen. Dr. Paul Thomas brought this model to Detroit a decade ago with Plum Health. His clinics promise same-day visits, transparent pricing, and time to actually talk with your doctor. So, can this model help cure America's broken healthcare system? Dr. Thomas joins us now to discuss that. Doctor, welcome to the program.
Thank you so much for having me on the Metro. It's great to be here.
So, for the past month, the government has been shut down because Democrats and Republicans can't agree on a budget. And one of the core issues, as I mentioned, has been federal subsidies for healthcare. Before we get into the nitty-gritty of how this model works that you follow, tell me this. What has your reaction been to seeing how polarizing funding for healthcare is in Washington?
Yeah, it's hard to watch our government not functioning properly and not allowing coverage for many of Americans who need it. And watching the prospect of folks losing coverage or seeing 24, 25, 30% increases in their health insurance costs on a monthly basis is very difficult to watch.
Now, you started your clinic in Detroit, almost a decade ago?
Yes.
I'm wondering, when you talk about things that are difficult to watch, what did you see in the healthcare system at that time that made you want to try something different?
Well, on a local level, there's one primary care doctor in Detroit for every 6,000 residents. And
Wow.
if you go north of 8 Mile into Oakland County, there's one primary care doctor for every 600 residents. There's a 10x healthcare access disparity to primary care in the city of Detroit versus Oakland County. And I set out to help address that inequity.
Now, when a new patient comes to see you, what are they usually feeling? What do they tell you about their struggles to get care elsewhere, to navigate what you're talking about here, which is a huge disparity between patients and doctors?
Yeah, for most patients who experience our clinic, they get to have one doctor that they get to see whenever they need it. We guarantee same day or next day appointments. They can message their doctor or call their doctor whenever they need to reach out to them. So for most patients, it's a breath of fresh air. They're able to have a direct relationship with their primary care doctor, and that's why we call it direct primary care.
So Plum Health runs on what you call a membership model, and patients are paying a flat monthly fee instead of using insurance. Explain more about how that works.
Well, we encourage that everybody has an insurance product, but we know that some people are disqualified from insurance because of their income level. Some bartenders, truck drivers, service workers might make $40,000 or $50,000 and they're disqualified from Medicaid at a $17,000 cutoff for individuals, but they don't have enough money to buy private insurance. But we take people with insurance who are uninsured, who are fully insured, and they can come see us at this $85 a month, and we provide 90% of all the care they need in the year. Primary care visits, preventive care, wellness, urgent care, and any chronic care concerns like managing their high blood pressure or diabetes. And on top of that, we save folks 50 to 90% on all of their meds, labs, and imaging services.
How? How are you able to do that?
Well, we make money only on the membership, and all the other things are pass-through savings for our members. So we buy medications at cost, and then we give those medications to our patients at cost. We negotiate with the national lab for at-cost labs, and then we give those lab prices to our patients at cost. And the same thing with imaging. We work with local imaging vendors that gives a 90% savings to our patients. I'll give a couple of examples. If you want to check your cholesterol and you go to Corewell in Royal Oak, they're going to charge you about $250 or charge your insurance $250 to check your cholesterol. At our office, it's $6. If you wanted to get an MRI at a large hospital in the area, they might charge you $3,000 or $3,800, like let's say an MRI of the knee. The actual cost for an MRI at a freestanding imaging center is $380. Again, a 90% savings. We just work within, the free market of Metro Detroit and Michigan to save our patients a lot of money. And we do this in Detroit, Royal Oak, Lansing, Corunna, and Van Buren. We have 5 offices currently.
How fast were you able to expand? I mean, you started with one clinic in Detroit in Corktown. What was the demand like for you to be able to build in this way?
Well, let's take a 10,000-foot view. 60% of Americans get their health care through their employer.
Yeah.
Right? And they get their health insurance through their employer. And employer groups are seeing 10, 20, 30, sometimes 38% increases year over year on their health insurance spend. And when you have a really smart, forward-thinking, self-funded employer group, they want to buy Plum Health or direct primary care services for their employees. And then we can come in and take care of 90% of their health care and pull it out of the insurance pool and show them decreases or stabilization of their rates. And that's where we succeed. And so we had a consortium of public schools, Lansing, Corunna, Van Buren, invite us to take over their primary care clinics that were near site and on site. We took over those care clinics, and now we provide care to over 4,000 people across the state of Michigan, and about 3,500 of those are employer-based.
So potentially, it sounds like there is truly a way to scale this model. But before we get into that, I want to acknowledge something, and that is that many of us are not only frustrated with rising healthcare costs, but it's also the sparse interactions that we have with physicians, that they're in and out of the examining room so quickly. How could they possibly be able to make some true informed assessments of their patients? I mean, and one of your promises is same-day visits and direct access to your doctor. But this has me wondering, how do you make that work without overwhelming your staff or raising prices?
I love that question, and we do that by right-sizing the primary care panel. Back in the 1980s, most family doctors had a panel of 800 patients. Today, the average family physician has 2,400 patients. They have to see 1% of their panel each day. That's 24 visits in an 8-hour working day. That means your doctor gets 20 minutes of time with you, but they spend 2/3 of their time documenting in the EMR because they need to get paid by the health insurance company. The EMR is there to get paid by the insurance company. So they're spending 8 minutes with you and 12 minutes on the computer per visit, right? And so 8 minutes is not enough time to really get to know somebody and be comprehensive in their care. We took that panel down and shrunk it to about 500 patients. Our doctors in the 400 or 500 patients per doctor. That means we see 1% of our panel a day. It's 5 people per day. That means we can spend up to an hour with each patient, and we still have 3 hours in our day to do the admin work of being a doctor, filling out forms, answering text messages and emails, getting urgent care visits in our door, right? We don't send our patients to an urgent care. If they call, they come and see us.
Dr. Thomas, from your vantage point as a primary care physician, what's the biggest thing driving up costs and frustration in American medicine today that you're clearly setting out to try and address?
Yeah, I think the big thing is that when you use insurance to pay for routine, inexpensive care, it inflates the costs. So let's say you have auto insurance. Everybody in Michigan must have an auto insurance policy if they drive a car. And now let's say you have to use your auto insurance to pay for gas or rotate your tires or buy windshield wipers, all the primary care maintenance for your car. It would cost 3 to 5 or 10 times as much as it should, and you need a prior authorization to drive to Chicago, right? But that's what we're doing with health insurance. Your health insurance, you go through your health insurance for everything from a flu shot, which should cost $16 or $17, to a Band-Aid, which should cost 5 cents, to blood pressure medications, which cost 1 cent per pill, or an MRI, which should be $350, not $3,500. So when you right size your approach to primary care, if you allow for a free market answer to primary care concerns and then insure for what you should insure for, cancer, heart attacks, strokes, then you can start to fix the cost problems we're facing in our healthcare system.
I mean, I think many people listening right now, and I know I'm speaking for myself, I have received some medical bills that have been downright offensive. I mean, I had an issue with my eye. It was swelling up. I didn't know what was wrong with it. It was late at night. I ended up going to the ER. I'm guessing because I have good insurance that's the reason I was charged a couple $1,000s for a very quick look at my eye. I was given some eye ointment, and luckily, thanks to my insurance, I think my bill was $100. But what I was charged, thousands of dollars for that quick interaction, it's very upsetting.
Yep. Every time somebody walks in the emergency department, the average bill is around $2,000. And when you have a direct primary care membership, or if you sign up all of your employees for direct primary care, we can reduce ER utilization by 40%. And so when you have a doctor that you can call, text, email anytime and be seen in the same day or next day manner, we can prevent 40% of those ER visits, and we can prevent 75% of urgent care visits. And so our focus is on keeping people out of the hospital and out of the emergency department and out of the urgent care clinics, because that's how we can really save people money and affect that cost curve.
This is the Metro on WDET. I'm Robyn Vincent. My guest is Dr. Paul Thomas of Plum Health. We're talking about America's broken healthcare system. How many Americans could see their premiums rise by hundreds of dollars, and what can be done about it? Do you believe this kind of subscription model that you have at Plum Health, that it could scale up to serve everyone, or does it only work in certain communities across income levels, city and rural?
Yeah, that's a great question. When I started my practice in 2016, about 9 years ago, I was one of 350 doctors in the United States practicing in the direct primary care model, and I was the second practice in Michigan. Now there's about 40 different direct primary care practices in Michigan, or doctors in Michigan, and there's about 3,000 different practices across the country, or 3,000 different physicians practicing across the country. And there's 120-some thousand family physicians in the United States. And I think that we'll get to an 80-20 rule eventually, where perhaps 20% of all family doctors are going to adopt this model.
Wow.
Because they want that direct relationship with patients. They want to have an hour with their patients. They want to prevent the ER visits and urgent care visits and be comprehensive in their approach to patient care. And the 8 minutes that they typically have with patients is not good with them. It doesn't sit well in their soul. They suffer from moral injury, from the frustration of being able to help people but not having enough time, right? So more and more doctors are moving into this model every year.
It hurts both the physician's soul and the patient's soul, I think we could
Indeed.
say. But if every doctor ran a membership clinic like yours, would we need a lot more doctors? I mean, would we have enough physicians in the U.S. to scale this model up?
Yes, if we had the political will to do that, right? If you tell a medical student at Wayne State School of Medicine, where I trained, look, you can be a radiologist and make $400,000 a year and sit behind a computer and read images, and you'll have to do it 8 hours a day, 5 days a week. Or you can be a primary care doctor and see a new patient every 8 to 20 minutes and have really low satisfaction. What would you like to choose, right? And I think if we show more medical students and residents the opportunity to engage with direct primary care, to have a fulfilling, satisfying career in medicine that's meaningful and impactful, we will have more doctors opting into this model. And then it's on us, the voters, us as the citizens, us as the politicians, to make more slots for primary care and fill those slots with eager young doctors who want to help America with this, really severe challenge.
Some health economists worry, though, that membership clinics like Plum Health serve mostly middle and upper income patients, people who can pay out of pocket, while leaving lower income or rural communities behind. What's your experience with that?
The exact opposite. I mean, if they want to come to our office, 1620 Michigan Avenue, Suite 125 in Corktown, we're at the Michigan and Trumbull intersection at the old Tiger Stadium site. Come in there, meet all of our patients. They come from all walks of life. Of course, we have some wealthier, higher income folks, but we also have people who are enrolled in Medicaid who opt to pay for the service because they love the care and experience that they get. We also have a lot of, like I said previously, truck drivers, hairdressers, bartenders, service workers, freelance photographers who want this type of care for themselves, who have maybe a basic or catastrophic coverage plan, but are buying Plum Health because they get their needs met in this way. And then the vast majority of our the company, the groups that we serve are school teachers and school workers and janitors and bus drivers, right? So we're talking about like middle America. We're taking care of folks who are traditionally underserved in some of our clinics in Lansing and Detroit and Corona and Van Buren. And then, we're really reaching into these communities and giving them an option for primary care.
Dr. Thomas, in the last minute that we have here, or 30 seconds, I mean, it sounds like you have made equity and access to healthcare really central to your mission. Why?
It's important to me. I grew up in and around Detroit, and I really believe that healthcare should be affordable, accessible, and excellent for everyone. And that's radical because it isn't. And my whole career has been dedicated to allaying some of these inequities and serving people in Detroit and in other underserved communities in Michigan with excellent health care that they can afford. $85 a month is less than most people's cell phone bill, right? And the family plans that we offer are less than what most people pay for Comcast, let's just be honest, right? These are really affordable ways to get excellent primary care that takes care of 90% of your healthcare needs. And I challenge the other healthcare systems in our region, I don't need to name them, who have zero primary care offices in the city of Detroit to build some. And let's allay these health inequities together.
Dr. Paul Thomas, his practice is Plum Health, a direct primary care service. Doc, thanks for joining me.
Thanks for having me.
This is WDET-FM, Detroit Public Radio, your connection to news, music, and conversation. And this is the Metro. Stay with us.